I'm gonna talk about cardiovascular diseases. First of all, we have to know what are cardiovascular diseases, and also known as heart diseases. These are the result from the narrowing of the arteries that supply the heart with blood through a process known as atherosclerosis. The fatty deposit gradually build up on the inside of the artery walls, narrowing the space in which blood can flow through all the heart. The atherosclerosis can start when you are young, so by the time you reach middle age, it can be quite advanced. So the plaque build-up can be considered as stable or unstable in some cases. If there is too much build-up of a stable plaque, it narrows the artery, causing pain and discomfort due to not enough blood reaching the heart. And all this process of pain is called angina and is needed to be treated. Then we have some causes from the cardiovascular diseases. The most important behavior risk factors of the cardiovascular diseases or heart diseases are unhealthy diet, physical inactivity, tobacco use, and harmful use or excessive use of alcohol. All these effects of behavior risk factor may show up in individuals as raise of blood pressure, raise of blood glucose, raise of blood lipids, and overweight and obesity. These intermediate risk factors can be measured in primary care facilities and indicate an increased risk of heart attack, stroke, heart failure, and other complications that all these causes can affect. Then we have some types of cardiovascular diseases. There are many types, but I choose the ones that I think that are more important. Like the first of all, we have anginas. This means pain in the chest from lack of blood flow. The other one, but more complicated and more that you have to pay more attention, are the heart attacks. The heart attacks basically is when a part of the heart muscle dies from loss of blood flow, and the heart basically stops from working. Another one that we have to keep an eye and pay attention are the heart failures. The heart failures are similar to the heart attacks, but in this case is when the heart can pump enough blood through all your body and through the heart that needs to beat. The other one is the arrhythmia. The arrhythmia is a problem with the rate of rhythm or your heartbeat. This means that the rhythm is abnormal. It could be slower or higher than it usually goes. And when this happens, the problem that cause is that you don't have a stable rhythm, and that can cause to other problems like a heart attack or a heart failure. And in how to prevent cardiovascular diseases, we have stop smoking or never start smoking, because as we all know, smoking causes a lot of damage on our systems, and one part that affect smoking is the heart. So stop smoking is a way that we can prevent. And other thing like smoking, it could be stop sharing alcohol in big amounts. So that will be some things to prevent. Another one could be keep a healthy weight. This means that we have to do workout and have a healthy diet, because another thing that can cause cardiovascular diseases is the obesity or the overweight. So to prevent that, we have to keep a healthy weight, and to do this, we have to work out and have a healthy diet. By workout, this means that we have to do some exercise or something that our body keeps working. And by having a healthy diet is to restrict the amount of food that we eat and some things bad that can affect our heart. Like for example, the amount of salt. The amount of salt in big amounts, it can affect our heart. So the people that have these diseases have to decrease the amount of salt that they inherit constantly on during the days. And to doing this, we have a diet for all the weekend that we separate on breakfast, lunch, and dinner. First, we're gonna do it on the breakfast. On Monday, you can eat a whole wheat bread toast with boiled eggs and with some avocado and glass of unsweetened milk. On Tuesday, a natural unsweetened Greek yogurt and oat cereal, and some decaffeinated coffee, because this is something important uh, that of course the caffeine affect the rhythm of our heart, so you have to decrease the amount of caffeine that you inherit. On Wednesday, you can eat a strawberry banana smoothie and fresh cheese with oats. On Tuesday, a piece of fruit with unsweetened milk. This is also because of the weight. You have to decrease the amount of sugar and all the things that usually we eat in our normal days. And on Friday, we can eat oatmeal cookies and sugar-free natural yogurt with blueberries. And that will be the breakfast from the weekend. Then we have the diet of the lunch. On lunch, on Monday, we can eat a whole grain spaghetti with tomato and tuna. On Tuesday, a lentils with rice, carrot, and green pepper cherries. On Wednesday, we can eat vegetable soup and grilled turkey fillets. On Thursday, a roast lemon chicken and potatoes with kale. And on Friday, we can eat a bacalao with cream sauce and tomato with integral rice and so some kiwis, because we have to constantly inherit fruits. And for dinner, on Monday, we can eat a milanesa schnitzel and a tangerine. On Tuesday, we can eat a salad rice with garlic and some apples. On Wednesday, we can eat a baked salmon with green pepper sauce and beans and cherry. And on Thursday, we can eat brown rice and lentil stir fry and some orange. As you can see, we are constantly adding some fruit to our normal days. And on Friday, we wrap with sauteed beef and lettuce and also another fruit, a banana. And for ending the presentation, the cardiovascular things, the cardiovascular diseases are something that we have to keep a lot of attention, because it could affect us when we are younger, but if we don't treat them or we don't take care of them, it could affect us when we are in a middle age. Because as we all know, when we are starting to get older, our heart is not the same as when we are younger. So all of this is also to prevent all these diseases, because when we are younger, we have to take this advice like work out and decrease the amount of salt that we usually consume. And all of these are the complications and causes of heart diseases. Thank you.